what was supposed to be a fun trip for all of us turned into a not so much fun trip because at the beach in 2020, I remember it was October 2020, it hit me horribly where I couldn't stand, I couldn't sit, I couldn't lay down, and usually doing one of those would provide some relief. This day, there was nothing that was providing any type of relief. Right? So I started realizing, okay, maybe it's a little bit more than some sort of pulled muscle or pulled hamstring. It was still centralized to the lower back, but I really couldn't move. I was pretty immobile the entire weekend.
Welcome to Bed, Back, and Beyond, sharing positive stories of recovery from serious back or neck injury. Your host is CK, a fellow champion who draws on her own experience with herniated disc surgery. Join her as she talks with others who have overcome the physical and emotional trauma of a painful injury, and discover for yourself how you can find hope and encouragement in recovery.
Today we are talking with Robert Carmichael, a spinal fusion success story.
Hi, Robert. Thank you so much for joining me on this episode of Bed, Back, and Beyond. Before we dive into your backstory, how about you just tell us about yourself?
Yeah, absolutely. So my name's Robert. Live over here in Charlotte, North Carolina. Married. I have a 14-year-old son. We've been in Charlotte for about 13 years. We're originally from Puerto Rico, though. Moved to the States in 2003. Back then, I used to work with the federal government, so we moved around quite a bit. We first lived in D.C., then Chicago, and then ultimately wound up here in Charlotte. And I think we'll sort of retire here in North Carolina eventually. Maybe not Charlotte per se, but I think we'll stay in the state of North Carolina. And glad to be here with you.
Thank you. The most I've moved around is from Pennsylvania to Delaware and then back to Pennsylvania again.
Hey, some people, stay in the same town their whole lives. So at least you moved around a little bit.
Yeah. And I've yet to visit Puerto Rico.
If you go, let me know. I'll give you some good spots to visit. It's a great place. Unfortunately, like with any smaller type of island and or country, it's not a whole lot of jobs, and the economy isn't the greatest. So it's if you go there for a couple of weeks, you'll love it. But there came a point in time where my wife and I sort of decided we had to make that move.
Time to move. So when about did you start having some back issues?
I was thinking about this. My wife and I talk about it all the time. The earliest I could come up with was 2018. And I remember that year specifically because I remember the job where I was, my employer at the time. And I sort of associate my back pain with, not that the job caused it, but I remember being there when I first started having symptoms. And the symptoms were weird because at first, and now I'm 47. Back then I would have been 41, early 40s, in relatively good shape, had never had any issues physically. So I didn't think anything of it. But the way it first started was it was sort of like the hamstring, and it went up to my lower back a little bit. And we would always take these walks at work just to, get out and get some fresh air. And I remember a couple of days walking where I literally could not walk because I felt what I thought at the time was the muscle just pulling.
Okay.
And it was excruciating. And I would get back to the office and, as soon as I would sit down, I could feel that relief. But then there were other times in the office where if I was standing for even more than 5 minutes, same thing, is debilitating pain in the office. Again, I just attributed it at the time to, maybe I pulled a muscle, maybe it's not a big deal. And it wasn't every day. It would sort of happen off and on, maybe once or twice a month. So I really didn't think too much of it. But, to answer your question, it started around 2018.
Okay.
I can go on further, but or I didn't know if you had a follow-up question to that.
Yeah. So did it get to a point where it was happening every day then?
Not at that point. So it was off and on from 2018 to about 2020. And I remember a specific situation. We were at the beach. My son, he does Taekwondo, and his Taekwondo school does a yearly trip to the beach. And, what was supposed to be a fun trip for all of us turned into a not so much fun trip, because
Mhm.
at the beach in 2020, I remember it was October 2020, it hit me horribly where I couldn't stand, I couldn't sit, I couldn't lay down, and usually doing one of those would provide some relief. This
Mhm.
day, there was nothing that was providing any type of relief. Right? So I started realizing, okay, maybe it's a little bit more than some sort of pulled muscle or pulled hamstring. It was still centralized to the lower back, but I really couldn't move. I was pretty immobile the entire weekend. I didn't know who to call.
Mhm.
I didn't know the procedure for like back situations. I didn't know what doctor treated back issues. So I ended up calling a chiropractor in the town where I live here in Charlotte and scheduled something. I think I called them that Saturday. They were open Saturday, and we scheduled it for that Monday. So they saw me right away. They take X-rays, and that was the first time that anyone had ever told me that they found something kind of weird looking with my lower back. At that time, they really didn't provide a diagnosis yet. They could only tell me that it looked like it was fractured in the
Oh,
lower back. So that kind of freaked me out,
sure.
but they said, "Hey, look, nothing to worry about. It looks like this fracture happened years ago, and you're just sort of feeling the after effects of it now." And they said it looks like everything's been covered with nerves and with muscles, and it looks like everything's sort of there. But that fracture, they said, it looks like it may have caused a slippage at your L5S1 vertebrae.
Mhm.
At that point, it was a minor slippage. They said not a whole big deal. They put me on this plan for a couple months to do chiropractic care. And I gotta say, they did an amazing job with me. They, little by little, and I know chiropractors aren't for everyone, and I certainly don't want to sort of tell people that that's the way to go. Obviously, people should know their body better than anyone else.
Right.
But for me, it worked,
Right.
initially at least.
That's generally the
Um,
story. People either love them or hate them.
I know.
Whatever works for you.
I know. Have you been to one?
I did not. I was actually trying to go to one the day before my big herniation event,
Got it.
and the one I pulled into was closed, and the other one was on the other side of the highway, and I was at that point I was in so much pain. I was like, I just want to get home.
I believe
So
it. Yeah.
yeah,
No. Maybe it worked out for the best. Maybe
yeah.
it would have been worse for you if you did it. But for me, it really did alleviate the symptoms. Now, what I ended up doing was I still went to an orthopedic doctor, an orthopedic surgeon, while I was getting the chiropractic treatment. Because even the chiropractor said, look, they specialize in that, but they're not surgeons or anything, right? So
Sure.
they said, you may want to get a second opinion while we sort of work on your back a little bit, see what they say. So the orthopedic surgeon took a look at me, and that was the real first diagnosis that I finally received. And what they ended up diagnosing me with was, it's called spondylolisthesis, which is basically a slippage of the vertebrae. And the reason it slipped is
Okay.
because I have what's called a bilateral pars defect. What that means, it really is almost kind of like a fracture of the spine. But what that means is, we have the vertebrae, and then on the back of the vertebrae, we have these little bones that sort of connect the vertebrae.
Hmm.
So at the L5S1 level, there's those small bones never connected. Come to find out, it was a birth defect that I never knew I had.
Okay.
What the doctor said was that it's fairly common, and most people don't even realize they have it. Now, most people can get through life without having any pain.
You can't even look back to past 2000 or before 2018 and say, "Oh, that explains this or
No,
that." Okay.
no, no, it's funny how you say that, because my wife and I were thinking about, I've had a couple car accidents, I've had a couple tumbles. We were like, oh, maybe it was this, maybe it was that.
Yeah.
The doctor said, look, it was nothing. It was just birth. It
Mm.
was, you were just born with that. And the reason that most people don't feel it, and if you do feel it, you won't feel it until middle age, is because, when you're in your teens and 20s, you're in pretty good shape. So you're running around, you're not feeling anything. Once the body starts to wear down, that's when you start feeling the symptoms of it, which sure enough, that's when I started feeling it. But yeah, so I go to the to ortho care, and They took a look at me. I'm still doing the chiropractor. And like I said, the chiropractor did such a good job on me that after about 4 or 5 months, I really didn't need him anymore. And he even said, look, if you feel good, there's really no need for you to keep doing this. Just call me on an as needed basis.
Okay. And can I ask,
Yeah.
was the chiropractor's aim to shift the bone back, or did they explain what their treatment was
Yes.
doing?
Yeah.
Okay.
He was honest. He said, look, we're not magicians. A lot of chiropractors will go out there and tell you that they can, sort of fix it. He said, what we can do is, he described it as sort of opening up that space a little bit and sort of shifting everything a little bit back to
Okay.
where it used to be. Now, he was honest in saying it's never going to stay in place.
Right, because those
Um,
bones aren't connected, you said.
Correct.
Right.
Right.
Okay.
Right.
Mhm.
But for the time being, temporarily, they can sort of put everything back into place. And, if I have a really bad day, I could always call him and go back in. And, it's sort of from here on out, it was sort of like just maintenance as you would do a car.
Sure.
You would have to take it in every so often to get maintained and whatnot. But it went so well for me. I basically stopped going to him for about a year and a half. Everything was good. Then about 2021, so that was 2020, about 2021, the pain came back 10 times worse.
Oh.
For no rhyme or reason.
No
It just
reason.
did.
Okay.
No. Yeah, it just did. At that point, I go back to the chiropractor. I start back up with him. But now I realize that his treatments weren't doing a whole lot for me anymore. What I end up doing is I go to a new doctor. Now I go to a neurosurgeon.
Mm-hmm.
And I get a second opinion, or a third opinion at this point, to see what's going on. And he basically said the same thing that the orthopedic surgeon said and that the chiropractor said. He basically said, look, it's spondylolisthesis. It used to be a grade 1. Now it looks like it's a grade 2, 4 being the worst. So now it's shifted even more. And on top of that, the disc in between the vertebrae has sort of gone out of place, and what's left of it, because what was left of it was almost nothing.
Wow.
So he's like, that's why you're in so much pain right now.
Okay.
He said, you don't need surgery right now, but at some point you are gonna need surgery. And that hit me like a ton of bricks, because again, like I said before, I've been super healthy up until then. Surgery never really was anything that I thought would be something that I had to do. So I remember that day when he told me that I fell into this really, really funky depression.
It's a bit devastating.
Yeah, because it's either, okay, am I going to live with this the rest of my life in absolute excruciating pain?
Right.
Or am I going to get a surgery where there's no guarantee that it'll work? Because what he'd also told me was, as you probably know, with all the nerves in the back, you could end up worse. You could end up the same. It could be better.
Mm-hmm.
So he sat me down, and I give him a ton of credit, because he was really honest with me. And he said, look, there's about a 30% chance that this may not work. But on the flip side of that, there's a 70% chance that it could work. Right. So let's look at the positive.
Right.
And the 30% chance comes with, when you start moving them, and I've since become an expert just because of all the doctors I've spoken to, but I guess the 30% chance that it doesn't work comes with, you move nerves around to sort of get in there. You don't know if there's going to be nerve damage, or if anything like that, or if, in my case, I needed a spinal fusion, and if the screws are going to fuse the right way, stuff like that.
Right.
But he said, look, Robert, we do this, with our eyes closed. Basically, we do this. He does like 2 or 3 surgeries a day, not even a week, but a day, because he's so skilled at it.
Mm-hmm.
So he said, don't worry about it. You don't need surgery now. It's nothing life threatening, but it is something that you're probably going to have to get probably within the next 5 years or so. He said, for now, try and do as much as you can at home to alleviate the pain. So what I started doing was, I was like, in my mind, I'm sort of going through those steps of, I forget what they call it, but the steps of grief or whatever, denial and all that stuff. So So my first one was denial. In my mind, I'm like, there's no way this is happening. I'm never going to get surgery.
Right.
I'm sure I can beat this. This isn't a big deal. So I start doing yoga. I start doing physical therapy. I get like a 2 or 3 injections into the spine.
Okay.
I even I dropped 30 pounds. I changed my diet completely. I even got what's called a neuromuscular electric stimulator, which is basically, to stimulate the
Yes.
nerves. And, so I'm trying everything at this
Everything.
point. Yeah. I'm
Yeah.
like, there's no way I'm getting surgery. This doctor doesn't know what he's talking about.
Mhm.
I'm good to go.
It definitely is
Um,
the stages of grief because suddenly your body is betraying you and
yeah.
you get into this mindset like you're never going to be the same person again.
100%,
You know.
100%. And you're going through all this, and it was such a crazy time because there would be days where I would have decent days, and I'm like, oh, I got over this. I'm good to go.
Mhm.
And I'll get outside and do some yard work and stuff like that. And the next day, I'm just, I could barely move. The pain got so bad, I could barely go outside to throw the football with my son for like 5 minutes because I
Right.
couldn't stand up at all for 5 minutes.
Yeah.
At work, I do a lot of trainings and presentations in the office. To have to stand for a couple hours to do a training would just completely destroy me for that day. I would need the rest. So I would give a training or presentation from 9 a.m. to 12 p.m. I would need the rest of that day to come home and have ice on my back the rest of that day and the following day. So I was useless for about a day and a half
Wow.
after doing those trainings. That's how much pain I was in.
So at that point, it sounds like not being able to live your life versus a 70% chance of being able to live your life was starting to
So
sound a bit
that is
attractive.
exactly, yeah, that's 100% accurate. That's where I started sort of, the next whatever steps in grief or whatever it was, sort of accepting it, right? And
Right.
and slowly but surely I started accepting it because, to your point, I could no longer hang out with the family, with friends. If we did go out, I would have to plan ahead. Is there
Mhm.
going to be a place where I could sit down? Is there going to be
Right.
a place where I could lie down? I remember having the last Christmas at my sister's house, who's about 2 hours away. I couldn't go, so I told my wife and my son to go. My parents were there, my whole family was. I couldn't make it,
Mhm.
so I spent Christmas on the on the living room floor, just unable to move.
Right.
So that's when things started hitting me. And back to your point, is it worth being in all this pain and not living life? And what's the worst that could happen now if I have surgery? Maybe I'll just be the same in pain, but maybe it'll be better.
Right. Right.
It can't be any worse than this.
Right.
I thought to myself. So after about a year and a half of putting surgery off, I went back to the doctor, to the neurosurgeon, and he's like, yeah, if you're ready to pull the trigger, let's do it. We can do
Yeah.
it. That sort of started this whole other avenue of pre-surgery things, right? You have to deal with insurance, and
Sure.
you have to get cleared by your primary care provider. You have to do all this blood work because they want to make sure everything's good to go.
Right.
Um, Credit to everyone involved. I know insurance companies get a bad rap, and this whole process gets a bad rap. Everyone was awesome with me, to be honest with you. Everyone was great. Everything got cleared. Everything got approved. The surgery gets planned, but like with everything, you got to wait for an open date. So I think it was like 2 months out in advance, which for me was fine because I needed to mentally prepare for that surgery.
Right. One of the worst things for me to deal with when I got the microdiscectomy, so I didn't
Yeah,
get a spinal fusion, was everyone else's opinion of don't ever let a doctor open up your back. I would never
right.
let a doctor. And it seems like fusion is the worst, everyone's worst nightmare.
Oh, yeah.
Did you have that kind of
Oh
experience?
my God. So yeah, and it drove me insane
Yeah.
because I would usually get these comments from people who don't even have back issues, right? They're
Right.
like, oh, I hear fusion, is the worst because you never end up the same.
Yeah.
You're gonna be paralyzed, the screws are gonna fall out,
Yeah.
all these horror stories,
Yeah.
right? And again, credit to the surgeon. He said, look, there's pros and cons to everything in life, right? You could
Mhm.
go to the dentist and something might go wrong. So, he reassured me. He's like, look, there's a good chance that everything's going to be okay. But to your question, um, I mean, people were coming out of left field, right field, telling me, don't do it, don't do this, that, and the other.
Yeah.
But then that's when I said, all right, I need to sort of like focus on my own body and
Mhm.
sort of try and understand what I need to do. And that's why I give credit to folks like you, because if it weren't for, and I didn't know you back then, obviously you and I just met, but what really helped me get through this was people having channels like yourself. And
Right.
I would go on YouTube and I started seeing all these success stories.
Right.
And it was really 9 times out of 10, even more, it was like a success.
Yeah.
So I'm like, holy crap, maybe it's not as bad as people make it out to be. This
Yeah.
isn't 1950 anymore where, you're going
Right.
to end up like Frankenstein. Like it's,
Yeah.
pretty.
It's advanced.
Yeah. Yeah. Medicine now and technology is awesome. But yeah, it's so funny how you say that, because I had so many people tell me, there's the last thing you want to do is surgery, this, that, and the other. And I'm
Yeah.
like, wait a minute, you don't know what I'm going through. So I get it that, there was no malicious intent with what they were saying, but it
Right.
really didn't help my mental stability there either.
Right.
But yeah, so we scheduled the surgery, and what I haven't mentioned yet is I've still suffer from anxiety and depression, and so that threw me into a tailspin. Just coming to the realization that surgery was going to happen,
Yeah.
starting having panic attacks, which
Mhm.
I had not had for years because I got it under control. But all of a sudden, they came back, right? And I remember this one day at work, I just had a full-blown panic attack. I couldn't move. I just start
Mhm.
crying. I
Yeah.
couldn't, I go outside to get some fresh air. I literally can't put like one leg in front of the other to walk because I'm so paralyzed just at the thought of surgery. Especially because it's back surgery. And it's
Right.
like, other than brain surgery or heart surgery, I don't know what else is at that level. But I go see my doctor. We talk about medication, and again, credit to everyone. As long as you don't abuse certain things, we got on this plan of medication, and it helped me out a lot to prepare for surgery. And I'm no longer on the medication. I'll get to that here in a couple minutes. But long story short, preparing for the surgery was a 2-month process. And the pain got so bad that I was really to a point where I almost welcomed the surgery now,
Right.
right? Because it's like,
Yeah.
how much worse can it get?
Sure.
And I remember the day of surgery, I was even pretty happy, to be honest with you. I was pumped up. I was
Yeah.
like ready to do it. And again, I'll give credit to everyone from the front desk person to the pre-surgery staff, to the anesthesiologist, to the surgeon. Everyone was amazing. They treated me and my family great. Day of surgery, they knock you out with anesthesia. And
What hospital were you in?
we were it's called Atrium Health in
Okay.
Charlotte.
Okay.
And I've since sent them about 20 thank you letters, 20
Yeah.
thank you emails, because they were amazing. Everyone from the janitors to to the nurses to the people who brought us food during our hospitals, everyone was great. So they knock you out, obviously, with the anesthesia. What I'll tell people, if you haven't spoken about it already and on your channel, is I've never been through anything like this. And when you're knocked out with anesthesia, you're like literally knocked out. When you sleep, you're sort of still, you have an idea that you're alive and that
Right.
you may hear things and you can feel your body moving and tossing and turning.
Yeah.
With anesthesia, it's 3 hours of, there's nothing going on. You're completely out.
And
Which
they
I
give
guess
you a
is
drug to they give you a drug to make you forget.
correct.
Part of
Correct.
the anesthesia.
Yeah, yeah. I guess that's a good thing, right? Because
Yeah.
last thing you want to do is have any sort of knowledge that you're going through a surgery or anything
Yeah.
like that. So I wake up and it's, it was like I literally blink my eyes and I wake up in post recovery room, and I'm still drugged up, and I'm high as a kite with everything. But I remember thinking to myself as I laid on the bed, I'm like, holy crap, I think I got through this. I think this is good. I think we did what we had to do. They roll me into my room at the hospital, and my wife and my mom was here staying with us to help out, and our 14-year-old son was there. That's when I first started realizing that things were going to be okay.
Do you know what kind of fusion they did?
A T-lift
Okay.
fusion, I think it's
And
called. So they can go in through either the front or the back. they went through the back with me
Okay.
because it was just quicker to get through. Sometimes what the surgeon said is the reason they go through the front, sometimes through the abdomen, is because if you go through the abdomen, even though it sounds worse, they don't have to deal with moving the nerves in the back around.
Okay.
If you're going through the back, they have to sort of move
Yeah.
the nerves to the side to do what they have to do.
Yeah.
Either way, it's, either way is kind of scary, but again, they know what they're doing. So I spent 3 days in the hospital. And I'll be honest with folks, and I don't want anyone to get discouraged when I say this. It was the most painful days that I've had, even before the surgery. But the pain was because of the surgery, not
Sure.
necessarily because of the back issue anymore. It
Mhm.
was just recuperating now from the surgery. Any type of movement, any type of breath, really, really hurt. But I will say this: what they tell you is, even though you're in a lot of pain, you need to start getting up and moving, walking a little bit. What I didn't know was that walking, you have this thought in your head that if you even move, these screws are going to fall out.
Right.
Um,
Yeah.
but it's the total opposite. They said movement helps with the fusion and it helps everything sort of get used to each other.
Okay.
And I had 4 screws and a bone graft in between the vertebrae. So I'm thinking to myself, do you seriously want me to get up off the bed and start walking? Like, isn't everything going to fall out? And they're like, no, that rarely happens.
Mm.
These are titanium screws that are meant to be in the, they reassured me about everything. So the nurse comes in, the physical therapist comes in, and they sort of teach me how to start getting up out of the bed without twisting. I can't twist, I can't do a whole bunch of things, but
Do the log
they,
roll.
do the log roll,
Right.
exactly. Yeah, that's it. And so I get up and they say, look, don't overdo it, but be consistent in walking and,
Okay.
and while you're here at the hospital, even in the hallway.
Mm-hmm.
5 minutes. Just do 5 minutes, go back to bed, get your rest, get up 2 hours from now, do 5 more minutes.
Mm-hmm.
So I started doing that, and it was really tough because it was every step I took, it really hurt, like
Yeah.
a lot. It was really really painful, but I knew that was the best way to get out of the hospital, and then second to just start the rehab on my own. So I would get up probably about every hour and walk 5 minutes around the hallway.
Okay.
So I did that maybe 3 or 4 times a day. The next day, on the second day, I do it maybe 5 or 6 times a day. So I start building my way up a little bit. You don't want to overdo it, but you want to try and do a little bit more each day. And then by the third day, I was still in pain, but I was at a faster pace, I guess.
Mm-hmm.
Third day, they check your vitals, make sure everything's good to go. And they finally discharged me, which was great because coming home was such a relief.
Yeah.
The hospital's great and they treated me great, but you don't get any rest there
You don't.
because they're coming in.
Yeah.
As I'm sure they're coming every 2 hours to make sure everything's good.
Yeah. The microdiscectomy, my surgery is usually an hour and a half. You spend a couple hours and then you go home. I had to spend 3 nights in the hospital because I had a dura tear.
I don't know what that is. What is that?
So there's a film that surrounds your spinal cord nerves.
Okay.
And it keeps the fluid in there. So if that tears, then the fluid leaks and your body pressure is all out.
Holy cow.
It causes migraines and stuff. So they have to patch it, either like a blood patch or something. So they had to patch mine, and then I wasn't allowed to move for 3 days. I had to stay flat on my back.
Wow.
For 3 days. And then the third day, they just did like a slow incline every hour. They would just raise my bed.
Oh my God. Now, did you know about that? What's it called again?
A dural tear.
Did you know about that tear going in, or did they find that out as they were operating on you?
So my herniated disc was glued to the spinal cord, and they didn't know that when I went in. So they couldn't tell by the MRI. So when they started trying to remove it, they tore the dura. So there's still a chunk of the herniated disc material on my spine.
It's still there.
It's still there. Yeah. But yeah, so I had to stay there for 3 nights with nurses coming in every
So you
couple hours, the lights stay on.
again, as great as they were with us, there is literally no rest there. I think I would get like 30 minutes of sleep at around 4 a.m.
Mhm.
Those three
Yeah,
days. And that was it. And then you have other patients that are close by who are unfortunately, in pain also, and you hear them, and you hear the chaos of. So
mhm,
it was not an easy stay for anyone,
yeah.
and I guess that's the same for anyone, but it was hard to rest. So coming home was awesome.
Yeah,
I remember coming home, and my mom and my wife helped me get to the bed. And I remember I'm not a crier at all, but I remember when they put me in bed, I remember just letting out some tears of pain, but also just happy to be home.
right. Did you have any more panic attacks post-surgery?
No, that was all cleared up.
Mm,
There are things that come with post surgery. Having bowel movements was hard for me. It took me
right.
about a week, and I'm usually
Mhm.
someone, I don't want to gross anyone out, but I'm usually someone who goes about 5 times a day, 5, 6 times
Yeah.
a day. So it
Yeah,
was
that's
really hard.
yeah,
What?
anesthesia will stop your
Yeah.
bowels. Yeah, so it's hard for a lot of people.
See, and I didn't know that because
Yeah.
again, I had never been through any type of medical situation. So, on top of the pain, you also have the stomach pain of not going to the bathroom. So
Mhm.
everything kind of sucked for a few days, but
Yeah.
I was still happy to be home. A couple things that we bought that I'll recommend, and I think I was able to take a look at a couple of your videos. And I think you mentioned this in one of them. I can't stress enough how important it is to get one of those 4-foot grabbers
Yes.
to pick things up off the floor, because you're not going to be able to bend at all.
Mhm.
So I recommend folks getting a grabber. Um, and the other thing that we bought was a toilet razor. That's
Yeah.
the only thing. That's like a 4 or 5 inch razor.
Yep. It's like the
Um,
number 2 recommended. The grabber's number 1 and a toilet seat riser is like the number 2 recommended.
a riser. Yeah,
Yeah.
that's it.
Yeah.
Yeah. And because you never realize how far down that toilet is
Yeah.
until until you have back surgery.
Yeah.
Um, so that did wonders for us. It was funny because I'm 6'1" and my feet were dangling a little bit with the riser.
Yeah.
My wife is 5'1", so she was
Ah, she's
she
climbing
was
up on the
totally, yeah, she was, to her, she was on a skyscraper
Yeah.
those first few weeks. But what I'll say is this: after I got home, when you see these videos online, you may see people who get better within a week, or people who it takes a year,
Mhm.
or people who are anywhere in between. I can't stress enough how important it is for people to understand their own body, right?
Yeah.
Because I was getting frustrated. I saw a few videos, and a few of them, after a week, they were back to doing normal things, and I was like, oh, I can do that. Then let's do that. And then I realized I'm not even close to getting back to normal,
Yeah.
and I got really frustrated, and I fell back into this sort of depression mode,
Mhm.
and on top of that, the pain of now, not necessarily the spinal pain, but the pain from surgery is like really, really rough.
Yeah.
uh so I had days where I'm like, I remember telling my wife, I'm like, holy crap, I don't know if this worked. I don't know if I'm gonna get through this. I don't know. I just couldn't see the light at the end of the tunnel.
Yeah.
um what I tell people is, and I'm sure you probably have too, is, and my wife told me this, and it really helped. Just try and focus on what you could do that day that you couldn't do the day before.
Right. Mhm.
And little by little, it took me a good 2 months to really kind of get back to like an average version of myself.
Right.
But what I noticed was, little by little, things started getting better and falling into place. And the first 2 weeks, I was like, man, I don't think this worked. I don't think I'm gonna see the light at the end of the
Right.
tunnel. Then you start, then my wife said, have you noticed that you're walking like, you know 20 minutes at a time now? And have you checked your step counter on
Mhm.
your phone? And then I start realizing, I'm walking like 2 miles a day just in my hallway.
Yeah.
Then I
When
got up
was your surgery, by the way? I don't think we said.
January 22nd.
Okay. Of this
Yeah,
year.
of this year.
Oh,
Yep.
wow. Okay.
Yeah, so I'm about 4 months out now.
Wow. Okay.
And then I got up to about 4 miles a day just in my hallway in my house. Then eventually I start going outside. Then eventually I start walking my dog. Then eventually I start doing more and more.
Mhm.
Being cautious, obviously, with my
Sure.
steps. But it's really easy to fall into this place where you think it's never going to get better,
Yeah.
because the pain is so bad.
Yeah.
Um, but it does get better,
It does. Mhm.
and after about a month and a half to 2 months, I start realizing, holy cow, maybe this did work. Maybe
Oh,
I
good.
feel great. I don't feel the nerve pain, the lower back pain that I had before. Before surgery, my leg would go numb.
Mm.
I couldn't feel my leg. My lower back was, like I said, I couldn't really move most days.
Mhm.
Now I'm at least able to move. Once the swelling goes down from the surgery, you realize there's no infection. You get past all those thresholds. But us human beings, we want everything in, like, we want everything to be better in 5 minutes. And
Yeah.
you have to be mentally prepared. As it might take a while. Long story short, 4 months after surgery, I feel amazing. I feel great. I no longer have. I'm as close to pain free as I've been in the past 10 years. To be honest with you,
Mm.
um, it's not perfect. I have
Sure.
days where it's stiff, but I'm okay with stiff. I'm also close to 50 years of age anyway, so I was going to get stiff regardless.
That's true.
Um, you know, um, you have to also realize how you sit and how you sleep.
Yeah.
We have a really, really cushy couch, and I quickly realized that doesn't really help my back
Mm-mm.
anymore.
Right.
I need more of a firm kitchen chair,
Right.
wooden, to be comfortable.
Mm.
Sleeping, if I have a bad day sleeping, I'll feel it the next day.
Mhm.
Not pain wise so much, just discomfort, really.
Yeah.
But as far as pain is concerned, I don't have painful days anymore. It's really just, I may have 2 or 3 days in a month where I just move a certain way, and it just kind of tweaks it a little bit,
Yeah.
but it's not painful. Flexibility, I've lost a little bit, but I'm
Mhm.
okay with that.
Mhm.
There's nothing I can't do that I used to do before, right?
Right.
So I can still get out there and do yard work, and when I put my shoes on, I can bend down.
Mhm.
There's a certain limit to the back where once you reach that limit, your back sort of tells you this is as far as we can go.
Okay.
Um, but it's not painful. It's just sort
Mhm.
of like a wall that you hit.
Sure.
But when I say that, it's not that you're going to be like this. You can still bend and you can still have flexibility. It's just not as much as you had before.
What were the, post-surgery restrictions like? Obviously, you had the log roll out of
Yeah,
bed.
so that's a good question. So no lifting of the first month was no lifting anything over 5 pounds.
Mhm.
No bending at all and no twisting.
Okay.
So for the first month I was just like walking like this because I was so scared that I was gonna do something to mess it up.
Right.
But I had time off work. I took 2 months off work. Luckily, I had a good support system. My wife, our 14-year-old, who's almost as tall as I am, and my mom came to stay with us. So they would
Nice.
basically handle things for me.
Okay.
But to answer your question, the first month was no doing any of that.
Mhm.
Once I had my first follow up a month and a half after surgery, they said, okay, now you can pick up things that are like at least, but no more than 15 pounds.
Okay.
And now you can start bending more because they want you to sort of get used to bending again.
Right.
When I had my first follow up a month and a half out, they realized the screws were good and everything's in
Okay.
place. And, they said, now you can start doing a couple more things. And progressively each month, you can start sort of raising that level of how much you can lift and how much you can twist. And,
Mhm.
now really the only thing I still do the log roll when I get in and out of bed, just because
Sure.
I just think it's good for the body anyway. I don't bend. I bend with my knees, with my legs rather than my back
Yeah.
now. And when I'm doing yard work, I just try not to pick up anything that's really heavy. I'm out there just about every day because I like working in the yard. But if it's something that's really heavy, I'll just ask my son to help me pick it up or something like that. So you got to
Mhm.
be sort of aware of what you can and cannot do. But those were really the only restrictions that they put on me medically or medication wise.
Mhm.
They said try not to take any anti-inflammatories the first couple months. What I didn't know is that sort of disrupts the bone fusion a little bit.
Oh, okay.
They want the bone to grow again over the screws,
Okay.
which to me just blew my mind because I didn't know
Yeah.
that was something that would happen. Um, and then they said, smoking is not great for bone growth. And what I had to give up was I was really into cigars, and I would smoke a lot of cigars, but it was a no-brainer to give that up if it meant, everything fusing the right way.
I had to give up margaritas for a couple weeks.
Oof, that's tough, especially when you're going through a tough time.
Yeah,
Yeah.
exactly.
So, what was the reasoning for giving up alcohol during the first couple of weeks?
Alcohol is an inflammation agent, so
Got it.
it'll cause
Okay,
inflammation in the body, and
makes
then
sense.
also because you're on different medications that you just don't
Sure,
wanna, mix the
sure.
alcohol with.
No, that's actually same for me. They the first couple weeks I was on some really strong meds, and to your point, I had to not drink. We drink red wine here. I just gave that up for a couple weeks. But again, not a hard decision to make when
Right.
when you want to recover.
Yeah.
But yeah, that's pretty much it. 4 months out now, and I tell folks if you need, like I mentioned to you, I got on Reddit, and I feel now that I have to sort of pay it forward, so to speak, and
Yeah.
help people understand what options are out there and
Yeah.
what they can and cannot do. And I tell people on Reddit or anywhere, really, if you're going through this situation and it gets to a point where you can no longer live your life, sure, surgery should be always your last option,
Yeah.
but it is an option out there,
Right.
and these doctors, they're amazing. They know what they're doing. It's been awesome for me. I was able
Yeah.
to get my life back. I don't regret anything at all. It's been the best decision I've ever made, to be honest with you.
Yeah, that's great. You're in the Reddit spinal fusion community, right?
Yeah.
Yes.
Yep.
So
Yep.
I did snoop a little bit on you because I can, I think I'm in that group or I see it a lot, and I saw you commenting on somebody, like just giving them encouragement. So,
Yeah.
I checked out your profile, and it shows all the comments that you've made in the
Yeah.
past, and all your comments are all just encouraging people and letting them know. So I was like, I have to ask this man to be on.
No, I appreciate
Yeah.
you asking
Yeah.
because again, I thank you and everyone who has channels like this so much because without you, a lot of people would be lost and not know
Yeah.
what to do.
Mhm.
And you asked before about how many people were giving me advice, this, that, and the other.
Yeah.
And a lot of the advice people give is not really encouraging advice,
Right.
and it's not when you're going through something like this and all you feel is pain 24/7, you start feeling that this is the rest of your life is going to be
Right.
this way.
Yeah.
Channels like yours and encouraging comments is what helps people get through the day, to be honest with you.
Yeah. Yeah. And I created a Reddit community called Microdiscectomy.
Nice.
So there's like over 2,000 people in there, and a lot of them are
Nice.
scared that a spinal fusion is what's next. So I think your testimony will be a little bit of a emotional relief to see that.
Yeah, I get it. You hear the word spinal fusion,
Yeah.
it's a scary word. It really is. They're working on your spine,
Mhm.
absolutely.
Yeah.
But again, if there's anything I can tell people, man, it's they're in and out of your back in an hour and a half.
Mhm.
It's obviously there are people who have different levels and complications, and it may
Yeah.
take longer or may take less. But these surgeons, man, they're so awesome at what they do. And again, it's not like the 1950s. It's not like you're not going to end up like Frankenstein or anything
Yeah.
like that. Everything gets better. Spinal fusion is an option. I tell
Mhm.
everyone though, if you can live life without surgery, then more power to you. But if it gets to a point where you're just not living life anymore,
Right.
there is absolutely nothing wrong with surgery.
Right.
I heard so many negative comments, mostly from people who have never even had surgery.
Right.
And
And I think we have a tendency to look at surgery as if we're giving up, but it's
100%.
not.
Yeah.
It's like what you said, it's just another treatment option.
Yeah. Yeah. It's a treatment option that, quite frankly, may fix everything
Right.
moving forward. And the ironic thing is, the people who would give me the negative comments were people who have never had the surgery, But everyone I spoke to who did have the surgery, same as me. They're like, Robert, this was a blessing. It's been amazing since the surgery. I haven't had any issues for years after the surgery. Yeah, there's going to be a chance that you might need another surgery. I've never spoken to anyone who's needed a second surgery after spinal fusion, but I'm sure there's people out there who have needed a couple surgeries. But at least for me, for now, everything's worked out awesome. I don't feel the screws at all, because you get it in your mind that you're going to feel the screws. I don't feel the screws. My body feels the screws in a way that, my lower back feels a little different. But it's not like the screws are like poking at you or anything like that. It's really deep down in, and there's muscle and tissue that covers all that up anyway. So it's I don't feel a whole lot, to be honest with you, unless, like I said, unless I have a bad day. A couple days ago, our dog woke us up at 3:00 in the morning and I couldn't get back to sleep, and I just tossed and turned. And when I woke up, I realized that I just didn't get the rest I needed. So I felt that discomfort, but it wasn't painful. I was able to go to work and, do whatever.
Yeah. Now, did they recommend physical therapy for you?
So it's funny. I've heard yes and no from folks. My surgeon said you can if you want to. He was more focused on walking. To him, walking was the best thing that someone with spinal fusion could do. Now, my dog and I will go walk about 5 miles a day. We'll go to trails or in the neighborhood and whatnot. He said there's nothing wrong with physical therapy. As a matter of fact, I have, physical therapists that I use through my job. I'm blessed enough that my job covered the physical therapy, so it's free of charge. So I can go back to her at any point in time. But the surgeon, he didn't recommend it, but he didn't not recommend that either. He just said, if you want to go and get physical therapy, you can. But what you should really concentrate on is, walking, the diet to avoid inflammation. So we do a anti-inflammatory diet, because now, even though things are great, there's still screws in your back. And at some point, every now and then they'll sort of irritate the nerves a little bit. So what you want to try and do is keep the nerves from, keep the inflammation down. So that's really important. Just lifestyle changes, things like that. But to answer your question, he didn't say yes or no. He just, he just sort of left it up to me.
Okay. Great.
I think at some point I may go back to her just to sort of strengthen everything a little bit.
Yeah. I think it's good to have some kind of plan in place for strengthening your back muscles, but also your back supporting muscles.
Yeah, because it's it's what holds everything together. You want to make sure everything's nice and tight there. So I'll probably end up going back to her sooner rather than later, probably this year. I think I just wanted to make sure. I mean, I'm up 4 months now, so I think I'm probably good to go to her.
That's great.
So,
and you want to give a shout out to your wife?
Yeah, my wife Liz Marie and our son Alexander. Without them, I don't know where I'd be. Having a support system is crucial, to be honest with you. If someone lives in a place where, maybe your family's not around or anything like that, and you say, oh, it sucks because I don't have a support system nearby, at least people know that there's people like you or people on Reddit that you can at least reach out to. So again, having a support system is crucial, even if it's virtually. But my wife, basically took care of me for 2 months. I couldn't do anything at all, so shout out to her, our son, and my mom, who's here for a couple weeks. So, yeah.
That's great. Robert, thank you again so much for agreeing to be on the podcast. I really think your story is going to provide a lot of hope to the listeners of the show.
Awesome. I hope so. Thanks for having me.
Yeah. And if you are a listener with a positive story of recovery from a serious neck or back injury, head over to bedbackbeyond.com and click share your story. I'd love to include your voice in the show. Bye, Robert. Thank you.
Take care.